Hello, I'm Celeste, and this is Week by Week. On today's episode, my husband Dave and I talk all about week 21 of pregnancy, including a deep dive into Braxton Hicks contractions. And later on, our guest is the wonderful Kathryn Gantt. Let's do this. We are in week 21. Past halfway.
Wow.
So if you are counting by months, which is not how pregnancy is counted, but is a nice reference point anyway, you're in month 5 of pregnancy right now. Baby is around the size of a carrot and somewhere around 10.5 inches and weighs anywhere between 11 to 12.7 ounces. You might notice there's a big jump up in measurement this week, and that's because at week 21, the measurements transition from going from crown to rump to head to heel. So that's why you might see a little, even a potentially couple inch jump from last week. Okay, so what's going on with baby? A lot of the stats this week are very similar to what's been going on, so I'm going to roll through these pretty quickly. Baby's still covered with lanugo, that fine hair, which we've talked about before. Their eyelids are forming, their digestive system's continuing to develop, their sucking reflexes are continuing to mature. Baby's own reproductive system is developing. And this is so amazing. I don't think we've talked about this. We have a boy and we're having another boy. But it is so wild that if you are pregnant with a girl at this point in pregnancy, they already have all their eggs that they're going to have for their entire lifetime. Isn't that so incredible? Baby's gaining more control over their limbs, and so you'll continue to feel them stretch and grow and explore, and their arms and legs are in proportion now. Baby's eyelids have finished forming. Baby's liver and spleen are working to produce blood cells, and now their bone marrow is helping with that as well. We talked about this last week, but their taste buds are developing, and they're at a place now where they can start to taste what you are consuming as well. So I've read a little bit that what you're eating now might influence what your baby likes in the future. But that's not totally, from our experience, what happened, because I could not handle kale the first pregnancy, and our son eats kale pretty regularly.
I guess, but I think it's more about what you do eat they will like.
They're more inclined to like.
That's what I think.
And that is true.
It's not as much your aversions. Yeah.
No, but it said, like, I read something that, and it was probably being cute, but it was like, if you want your baby to like broccoli, eat broccoli now, kind of a deal.
Right.
But I will say one of my biggest cravings throughout the entire first pregnancy was ketchup. And our son loves ketchup. I've said it before. I said it recently. This seems to be the ketchup corner of this podcast, but that seems to be consistent. And one recommendation in thinking about baby that I read through a couple different articles this week is it might be time to start at least honing in on a name. We're not quite there yet, but we're down to about maybe 4.
Mm-hmm.
So getting closer. So what's going on with you? As I promised last week, this week we are diving into Braxton Hicks contractions. And we're going to start out with 5 questions I found about Braxton Hicks from the Mayo Clinic. What do they feel like?
Quote, Braxton Hicks contractions are mild, irregular contractions during pregnancy. They feel like tightness in your abdomen. Some women feel a lot of Braxton Hicks contractions, while some women don't feel them at all. They typically last less than 30 seconds, and they are uncomfortable but rarely painful. These contractions also tend to occur more often and become stronger as you approach your due date. Finally, they're more likely to occur in the afternoon or evening, after physical activity, or after sex.
So I've definitely found that around 3 or 4 p.m. is when I really start to experience these, and then they tend to go into the evening. And throughout the pregnancy, as you get closer, they do get stronger and stronger based on my previous experience.
And if we're out on a walk, we tend to do a walk right before his dinner, right after our son's dinner.
Mm-hmm.
You definitely get them when we're
a
lot.
Walking, that's a big time.
That's the perfect time of day, and it's also physical activity.
That's right. So what is the purpose of Braxton Hicks contractions?
Braxton Hicks contractions help tone your uterus's muscles and prepare your cervix for birth.
How can you tell the difference between Braxton Hicks contractions and true contractions?
There are three primary differences. Pattern. Time your contractions from the beginning of one to the beginning of the next. Look for a regular pattern of contractions that get progressively stronger and closer together. Braxton Hicks contractions remain irregular.
For some reason, that felt slightly unclear to me. The first is talking about true labor contractions, and then the second is obviously the irregularity of Braxton Hicks contractions.
The second difference is duration. Time how long each contraction lasts. True contractions last about 30 to 70 seconds.
That one, from my experience, is really interesting because I feel like my Braxton Hicks contractions last longer than the typical Braxton Hicks contraction. But then when I was giving birth, my actual labor contractions lasted even longer. And it was sort of surprising. We had one kind of scare, which I talked about in our birth story episode, where I had a contraction that lasted 4 minutes long, which was terrifying. But it's just, on that note, I think it's interesting to feel sort of the slight differences between the two.
And then the last difference is change. True contractions continue regardless of your activity level or position. With false labor, the contractions might stop when you walk, rest, or change position.
How do you ease discomfort of Braxton Hicks?
Change your position, such as lying down or going for a walk. Take a warm bath. Get a massage from your partner. Practice your breathing exercises.
Obviously, check with your doctor to figure out what's safest for you and what's normal for your body. For me, lying down definitely helps. And usually if I'm having them sort of
like a cluster.
Yeah, more frequently, that means I either need to drink water or I have to pee. I've noticed that sort of brings them on as well. And some physical activity, like you mentioned earlier. But it's generally a sign for me that I need to take it easy. I just need to take a breath. My doctor has said dehydration and stress can definitely increase them. Yeah. What happens if you go to the hospital, but you're not actually in labor?
During pregnancy, expect false alarms. No one knows for sure what triggers labor, and every woman's experience is different. Sometimes it's hard to tell when actual labor begins. Don't hesitate to call your healthcare provider if you're confused about whether you're in labor or if you are experiencing Braxton Hicks contractions. Preterm labor can be especially sneaky. If you have any signs of labor before 37 weeks, especially if you experience vaginal spotting, consult your healthcare provider. If you arrive at the hospital in false labor, don't feel embarrassed or frustrated. Think of it as a practice run. The real thing is likely on the way soon.
One more thing on Braxton Hicks from my own personal experience. I think when I was in early labor, I thought it would feel more different than Braxton Hicks. And I'd notice like a huge, Braxton Hicks is one thing, labor is something else. It actually felt kind of similar. But then once you are in the next phases of labor and the pain kicks in and the real regularity of your contractions kick in, it is like unmistakable. It is different. But there, again, when I first read about Braxton Hicks, I was like, in my brain, this is going to be totally different than what contractions feel like. And they were actually more similar in certain ways than I expected. So more stats about you. According to American Pregnancy Association, if you place your finger about 1/2 inch above your belly button, you might be able to feel your uterus. Heartburn might be really kicking in if it hasn't already. I'm personally craving hot sauce so much, and I truly am like, why would you eat a meal if you don't cover it in hot sauce? The flavor is totally unappealing without it. So I'm riding that line between heartburn and indigestion and balancing that craving. So I know at some point it's going to tip and the pain is going to be worse than the craving, but right now we're doing a lot of spicy food. But if you are having particularly bad heartburn, the general guidance seems to be to avoid or minimize greasy or spicy food. Leaky boobs. I thought this was actually really interesting. I didn't know this. Your milk ducts are fully developed by the end of the second trimester in case of early arrival. So some people around this time start to experience some leaking from your boobs. You also might notice some kind of dry, crusty sounds so unappealing, but some dry colostrum that is starting to kind of come out, but isn't leaking per se. So some changes going on with your boobs and nipples. Itchy skin. So as your skin continues to stretch and your baby and your body continue to grow, your skin might become drier and more irritated and feel itchy. So look for lotions or oils that are pregnancy safe. That can help out. Stretch marks. We talked about stretch marks before. I'm going to just jump into it really quickly. Family history plays a huge role in stretch marks. Also, just your changing body. Some of it just happens because your body's going through a huge change in 9 months. My little PSA on it is that there's been a big push out there for pride and positivity about your body changing. And if that works for you, fantastic. More power to you. I think it's wonderful. There's also just body acceptance and saying, I'm not going to reject what's happening, but I don't have to be in love with every single change that's happening. And then there's also the discomfort of maybe you don't like what's happening with your body. I've certainly had my moments with that. And I just want to put it out there that you might be in a different category given the day, but just that it can be overwhelming. It can be hard. And my biggest takeaway in talking to my friends and guests about this is if you are feeling unhappy with some of the changes in your body, that doesn't mean you're not deeply grateful for this pregnancy. And I think sometimes we get into a mindset where it's like, I can't have negative feelings about this pregnancy because I can only have gratitude for it. And I just want to say you can have both. So that's my little PSA on that. A couple other fun symptoms you might be experiencing: breakouts, check; swollen legs and feet; varicose veins, unfortunately, check. And I wanted to also talk a minute about UTIs. This is an episode of some more challenging pregnancy symptoms, but it is kicking up around this time. So let's talk about UTIs. Dave, why don't you do a little reading? This is from the American Pregnancy Association.
A UTI, or bladder infection, is a bacterial infection of the urinary tract. UTIs are more common during pregnancy because of changes in the urinary tract. The uterus sits directly on top of the bladder. As the uterus grows, its increased weight can block the drainage of urine from the bladder, causing an infection. If the UTI goes untreated, it can lead to a kidney infection.
So a couple things you can do to prevent UTIs are making sure you're drinking enough water, peeing before and after sex. And just in case anybody has gotten to this point in life and doesn't know, always pee after sex. Always pee after sex, because that is how I got my first UTI when I was first starting to have sex. And you only have to make that mistake once, but boy, is it awful. Wipe from front to back. Another just beautiful tip that I think we all need to know: wear looser pants or clothing, and wear cotton underwear, or at least make sure the crotch of the underwear is cotton. Okay, and then some more personal feelings from this week. I'm definitely having a lot of Braxton Hicks. I've been starting to have back pain and some sciatic pain, and I get so scared when I have any back pain because the first pregnancy, I had kidney stones right around this time, and it started with some back pain. So anytime I feel it, I just get try to chug water and I get so nervous. But back pain is very common during pregnancy, and it's estimated that anywhere between 50% to 70% of people deal with back pain at some point during pregnancy. Feeling exhausted, but also having insomnia, which is just an excellent pairing. Our son waved at my belly this week and said, "Hi, baby. See you soon, baby," which was just the sweetest thing that's ever happened. And to wrap this episode up with more attractive symptoms, I'm definitely starting to feel like my gums are bleeding a little bit more. So the theme of this episode is pleasant pregnancy symptoms.
All I'm hearing is sexy.
It's a good thing that this is what turns you on. What did I Google this week? It's going to come as no surprise based on what we've talked about, but what trimester do Braxton Hicks start in typically? And it's actually believed that Braxton Hicks start as early as 6 weeks into pregnancy, but usually aren't felt until somewhere in the second or third trimester. But Braxton Hicks are generally felt around week 20 and then continue, as Dave said earlier, throughout the pregnancy and generally start to increase in intensity around week 32. So there you go.
What a fascinating thing.
I did not think about this the first way around, but it is interesting reading all this information. It does feel like this is like my body's gym time or workout time to prepare for labor.
Yeah, it's like the test run, the work. Exactly. Yeah. It's like
get those muscles toned.
Exactly.
Yeah.
The reps.
Yes, exactly. Yeah. Exactly. Mm-hmm. If only labor hurt a little bit less.
Because you did all those reps.
Yes. All right. That's it.
All right.
See you next week.
See you next week.
Or like in 2 seconds in our house.
Okay.
Okay, bye.
Bye.
Our guest today is Kathryn Gantt. I have to say, I loved this conversation. Kathryn is a registered dietitian and nutrition coach, certified in yoga, and the mother of 2. She's the owner of Kathryn Gantt Nutrition, where she focuses on helping moms reconnect to their body and their relationship to food in a positive and trauma-informed style. Kathryn Gantt Nutrition has a 3-month pregnancy and postpartum nutrition coaching program. And in this program, she addresses general nutrition, any disordered eating patterns, and how to have a healthy pregnancy and postpartum period through nutrition and improving your body image. Very exciting. Anybody who mentions week by week will get 20% off, and you can find more information and the link in the show notes. So make sure you check it out. She's also a returning guest, and both conversations I've had with her, I have gotten so much out of them. She's such a gem, and I can't wait to share it with you. So let's do this. Well, thank you so much for coming back.
Oh, I'm so happy to be back. Thanks for having me.
Oh my gosh, I'm so excited to talk to you. To start out, do you mind telling us a little bit about what you do?
Absolutely. So I am an eating disorder dietitian. I've worked in all levels of care of eating disorders, started in residential treatment at a women's facility, and then went to a day program and doing what's called PHP IOP. And then I was with an outpatient group for a couple of years. And now I have my own practice, Kathryn Gantt Nutrition, where I still focus on eating disorders, but also within that, focusing on the perinatal piece specifically. So pregnancy, postpartum life, helping mamas navigate that piece.
That is so fantastic. And congratulations.
Thank you. It's exciting.
I'm so excited to talk to you about the eating disorder, disordered eating side of pregnancy and postpartum, because I just feel like it's so under talked about. There's so much shame surrounding it, and it's hard to get resources to really figure out how to navigate it. How do eating disorders and disordered eating impact pregnancy and postpartum?
Lots of ways. And I think it's so interesting. I know we'll cycle around, but one of the biggest reasons people don't seek help is shame. They feel like there's so much shame around it, and so they don't want to talk to their providers. And there is such a high risk, like you're saying. So some of the biggest ones, starting even before you get pregnant, what we know is statistically it's harder to get pregnant if we have an eating disorder. If we're a restrictive eating disorder, we can have issues with our cycles being regular ovulation. If our body fat percentage is too low, it's just hard to get pregnant and have appropriate estrogen, progesterone levels that you really need for getting pregnant in the first place. And then once we're pregnant, it comes with risks too. So we could have issues with early birth, low birth weight, or high birth weight sometimes, increased risk for certain birth defects. A recent study came out that with certain restrictive diets where carbohydrate intake is really low, we're seeing a sharp increase in neural tube defects. So things like spina bifida, things that haven't been around for a long time, we're starting to see kind of come back. And just higher risk for complications in delivery and postpartum in terms of healing. Things like that are really prevalent with eating disorders in pregnancy.
One piece of information I received with my own history pre-pregnancy was that once you get pregnant, that mindset falls away and you just are, which is like beautiful, but not factual. And I struggled because though I wasn't actively restricting throughout my pregnancy, if I'm being really honest, I found myself having a hard time shaking the mindset. I found myself wanting to return to it. I was like, after the baby's born, I can get back to it. And that felt comforting in a way that I needed to keep healing in myself. So, what is the reality of people actually experiencing eating disordered or disordered eating in pregnancy?
So that's so great that you're so open about sharing with that, because I think that the more we can talk about it, the more people are in a very similar situation and the more we can actually do something. So the reality is a significant percentage of people with eating disorders are childbearing years. And what we do know is that for some people with eating disorders, pregnancy is a time of kind of reducing of behaviors or, things like that. But statistically, you're at your highest risk for an eating disorder coming back in the first year postpartum.
Oh, wow.
Yes. So if you have any history of a disordered eating pattern, a diagnosed eating disorder, first year postpartum, you are statistically at your highest risk for it coming back. So it's such a prevalent thing. You are not alone in that thinking of like, maybe I can do it differently in pregnancy, but I know I've got this thing to come back to once the babies come. And unfortunately, most providers inadvertently contribute to that, right? Like the praise of getting back into your pre-baby body weight or make sure you don't gain too much weight, like all these things that are well-intentioned, but if we are unaware of someone's history with food, can be incredibly triggering.
It's interesting too, because certain words even that are meant to be supportive, like you look healthy, can feel so triggering. And so it's like, it's a really interesting kind of balance to navigate well-meaning comments. And I think in pregnancy and postpartum, people really feel like they have even more agency to comment on your body. So just even filtering that out can be really hard.
It can be, because it is so true. I feel like there's just no other time where people feel as comfortable touching other people's bodies and commenting on other people's bodies. Like in no other world do we walk up to a woman and like rub her stomach.
Right.
Or comment so freely on their physical changes. So it is true. And people do try and be well-intentioned with their things with like, oh, you're healthy, or, you're bouncing back, or whatever it is, but it can absolutely just send someone right into a dark space.
Absolutely. Do you have any guidance for people who might enter into situations where they do feel triggered, how to continue to stay grounded or stay inside of a quote healthy mindset if that trigger comes up?
Yes. So it depends on the scenario. One thing, if you're with your provider, I advocate for everyone to be as upfront as possible about your history. So if you have had any eating disorder, disordered eating, if you're even just feeling the inklings that something's not right with the way that you're relating to your body changes or food, to voice that as soon as you can to your provider and start the dialogue. Because a lot of times providers will try and tweak how they say things. Like I have had clients who they don't see their weight checks. The doctor just doesn't comment at all on their physical state and just keeps it about the baby. Baby's growing great, just keeping it centered on that because there's been discussion. And along with that, to voice if something makes you feel uncomfortable. What you just said makes me feel really triggered, or what you said makes me worried, trying to put voice to the thought. That's not doable for everybody. That can be really uncomfortable for a lot of people. So for the people I work with that are like, I can't talk to my doctor about that, or I can't talk to my mother-in-law about that, and she keeps commenting on my body, whatever it is. Then you have to figure out, okay, so what do you need to get through that situation? And so for some people, it's like internal mantras of, my body's growing a baby. I'm doing something miraculous right now. I'm okay. For some people, it's like therapeutic grounding techniques. Like, okay, I'm going to name 5 things I can see. I'm going to name 4 things I can hear. And you're doing all this internally, but it's strategies that helped ground you and kind of hopefully stop the negative thought train that's now probably just out of control.
Are there some kind of general red flags that people can look for of saying like, ooh, I think this might be something I need to get some help with? I'll give an example. Like for me, I notice if I start restricting, like I go, I'm just going to cut sugar out this week or this month. It's a real slippery slope for me. And I don't have the tools yet to quite be able to do that in a way that feels totally healthy. So is there anything that people can kind of keep an eye on or flag if maybe they are starting to do these behaviors?
Yes, absolutely. So some of them is to check in about your energy. So one thing that I feel like I say 10,000 times in my day is energy matters. So if you're wanting to do something from an energy of fear, from an energy of shame or guilt, automatically something worth checking in on. So if I'm not going to eat this today because I feel bad about something I ate yesterday, or I am going to only eat this salad because I feel like I should, that's like the energy, something to check in about. Also, if it's consuming our thoughts, we are not supposed to think about food in our body all day long. We should have periods of time where we're thinking about it, making a plan to eat something, responding to our hunger. But then we're supposed to eat and be able to move on. If you're really thinking about what you ate, micromanaging what you're eating, things to look out for sure. If you're constantly hungry or uncomfortably full, so these are things to look for. So if we're constantly hungry, this should be a trigger of like, maybe I'm not eating enough. You know, maybe I need to pay more attention to my serving sizes, how I'm making my serving sizes. Is it based on what I think a serving size should be? Or is it based on what I think my body actually needs? And then if we're uncomfortably full, you know, binge eating disorder is a real disorder that occurs in pregnancy too. Am I uncomfortably full? When I eat, does it feel out of control? Like I'm not choosing when to start or stop. So those are definitely some big things. And then also if we just feel uncomfortable. So being pregnant is already uncomfortable, but if we're just worried all the time or anxious all the time about our body shifting, about every food choice, I would talk about it.
That's so helpful. And I love that it's coming from a place of curiosity and connection back to your body, because I think in pregnancy with all these changes, you would think sometimes you'd feel more connected to your body, but it's so foreign. It can feel a little like, wait, how do I connect back to this thing?
Yeah.
Asking yourself these questions with curiosity. I noticed you don't have any like, that's bad, that's good, there's no morality to it. It's just curiosity and checking in. And I think that's really important.
Yes. And I actually love that you brought that up. That is another really good kind of inkling that something might be up. If we're putting a morality onto a food item, right? This food is good versus this food is bad, or this food is healthy versus this food is unhealthy. There is no data that supports that, right? Like if we were to eat certain foods in excessive amounts without any balance, that could possibly have a health impact. But if we're talking about, I'll use, a donut, which diet culture would say, oh, donuts, they're not good. But there's no data at all that says donuts as part of a balanced way of relating to food and body is unhealthy. So if we have that all or nothing thinking about food or a good, bad, that's definitely something to check in about.
Thank you. Do you have tips for having a quote healthy pregnancy?
The big thing is it is very individualized.
Yeah.
Honestly, it's trying to stay centered and balanced. So I use that word a lot. I think pregnancy can be, like you said, a time for some people to really connect with their body. But a lot of people, especially if we've struggled with food or body, it's almost a disconnect of, oh my gosh, there are out of control changes happening to my body that I just have to roll with. And that is very uncomfortable. It's doing your best to find the small pendulums. And most disordered cycles or things like that, we have big swings. So like for some people, they restrict, and then it can lead to these binge episodes where we just pendulum swing over to the other side. And we see that with dieting too. So, you know, more orthorexia diet culture where we're dieting, and then now we're overeating. So to try and just stick with what does my body need? So we do have to pay attention to that. Nutrition education matters all the time. Also in pregnancy, because we want baby to be really healthy, all of the organs grow really well and bones. So bringing in nutrition education of like, okay, so I need to make sure I get good protein. I need to make sure I'm getting a variety of fruits and vegetables so I get good vitamin and mineral content. I need to make sure I'm getting carbohydrates because that's what helps form my baby's central nervous system and my baby's brain. And what do I want to eat? What is my body craving? How can I use food as a pleasure experience in pregnancy? So it's trying to find the mix of both of those.
Let's say you give into a craving, you're feeling really good in the moment, and then 24 hours later, you start on that spiral. Do you have any tips or tools for somebody to come back to center or feel maybe safer in that experience?
Yes. So that is so common, that kind of like late set in shame of like in the moment, oh my gosh, I've been craving this thing all week and I'm doing it. And then the next day you're like, what did I do? I've messed up, or whatever the disordered thought tells you. The first thing is to do our best to separate thoughts from actions. So thoughts are uncontrollable. And if we have a history of any type of disordered eating, they're almost automatic. You won't do anything and a thought will come up about what I should or shouldn't have done with food or something like that. And the best thing to do in that moment is to try not to follow it with fact. So a thought is not a fact. So we might have a thought, I feel guilty for eating that food. That doesn't necessarily mean that's fact. It might feel like fact. And so I work with clients on separating out, okay, I'm having the thought that I should not have eaten that thing. And then to try and look at it from like a scientific perspective of like, well, there's actually nothing wrong with eating that. I ate it in moderation. I was craving it. I enjoyed it. And everything provides nutrition is what I tell clients. Everything. Certain things provide different nutrition, but everything does. So to just do your best to recognize the thought, let it pass as a thought, and to make the right action. So if the thought is, I have to eat less today because I ate this thing yesterday, do the opposite action of like, no, I'm going to still honor my hunger. I'm going to honor my pregnancy, and I'm going to eat what I know my body needs.
There's interesting work to be done around trust, because it's saying like, maybe my brain isn't totally being honest with me, but a lot of times, again, there's that brain-body disconnect. So I stop trusting my body and I start trusting my brain, even though my brain might not be being honest. And my body, if I listen to it, probably is going to be a better guidance for me. How do we find trust in our bodies again if we've kind of gone through the cycle?
That is such a good question. And I wish it was more cut and dry, but it's trial and error a lot of times because you're so right. It's a natural disconnect from our bodies where it's hard to even know what our body is saying. I have a lot of clients who like tell me, I don't even get hunger cues. So how do I listen to hunger if I don't have a hunger cue?
Yes, I very much relate to that. Yes,
right.
Yes.
And so good point. Like, how do you? And so it starts with, I think, one, getting help that if you need it, right? So like, if you know, I can't tell how much food I need to eat, I don't have that skill at this time, bring in people who can help you, like a specialist eating disorder, an OBGYN who is versed in that area, things like that. And then how I work with clients is basically retraining your body. So you start with, you know, if I had to put together a balanced meal that included protein, carbs, fat, vegetables, I'm going to eat to what I feel like is fullness. And then I'm going to check in. I'm going to try and intentionally tune into my body and see what I feel. Do I actually feel full? Am I unsure if I feel full? Okay, so I'm going to hang out. And if I'm feeling like I'm thinking about food pretty soon after, or I'm curious about food, I probably didn't eat enough. So next meal, or I'm have a snack, but next meal, I'm going to eat a little bit more. And so it's a lot of trial and error, unfortunately, of practicing tuning in and adjusting meals accordingly, and then looking for what are my cues. If it's not a physical sensation of hunger, most people get something. And a lot of times it's obsessive thinking about food, finding yourself craving things. Like it'll manifest as that if we've learned to shut off the physical, like stomach growling.
You mentioned that in the postpartum year, the first year after postpartum, that there's a high chance of relapse or instance of relapse.
Yes.
What can we do to better support ourselves or pregnant / postpartum people in general during that first year?
I think from a provider perspective is most providers don't screen. I don't know if yours did, but I know my OB doesn't. And no one in the office, no one asks. They ask you everything else in your history, like everything. And so if there are any providers listening to this, I say add some screening questions. Ask your clients if they have ever had any struggles with disordered eating, eating disorders. They may say no, because a lot of times people don't register what they're doing as disordered. So to ask even specific questions, how do you feel at mealtime? Do you feel like you nourish yourself enough in the day? What does a day look like for you with food? You know, building in curiosity questions into the 10,000 questions that you get asked during your pregnancy. And then if you do see anything, set things in place for that person in postpartum. You know, have conversations with them about following up with a dietitian, set more postpartum appointments, because unfortunately you get one postpartum appointment in general, and that's it. so not a lot. So crazy. They see you all the time for 10 months and then they're like, bye. Good luck.
Like, it felt like a breakup almost. I was like, wait, remember me?
I know. Wait, we spent so much time together. I need you still. I'm more confused now. Where are you going?
Yes.
And then from the person perspective, if it's you that's struggling, is to do your best to put things in place to take care of yourself. So if that's setting up your own outpatient support with like an eating disorder therapist or a postpartum specialist, a dietitian, but then also bringing in loved ones. So having open conversations with your partner, with if you're going to have a parent or an in-law who's going to be really involved and you feel comfortable bringing up these things of like, I'm worried that I will struggle with nourishing myself, or I'm worried I won't know what to do to feed myself. So having people involved as support in making sure you get what you need, being able to look out for things not going well. Like, are they noticing I'm not eating very much, or I'm having these times where I feel like I can't stop eating, you know, am I disconnecting from people in a way that feels worrisome with food? And another piece is trying to check in with yourself. Like, how are you doing? It is already such a hard time. And along with the increased risk for eating disorder coming back, we also are at a higher risk for postpartum depression and postpartum anxiety at the same time. So all of these things require a team, you know, that it takes a village is real.
Yes.
It's so real. And so that's the biggest thing is be as vocal about your concerns as possible. And if you're not comfortable doing that, doing your best to reflect in an honest way and try and identify, okay, I am finding ways to avoid eating, or okay, I'm eating a lot in secret, and why am I doing that? You know, so really trying to reflect honestly on how things are going.
That's wonderful. You mentioned that a lot of times someone might not even really recognize that they have disordered eating.
Yeah.
I find that so interesting because I think eating disorders and disordered eating are one of those things that constantly are telling you you're not sick enough to fall under the category of this being an issue.
Mm-hmm.
Do you mind just briefly defining disordered eating and what that usually looks like?
The big difference between disordered eating and eating disorder. So an eating disorder, that is like clear cut, diagnosed. It's in what's called the DSM, which is like a diagnostic manual for mental illness. So those are things like anorexia, bulimia, binge eating disorder. The other part of that is disordered eating, which is not technically a diagnosable thing and exists on a spectrum. And really, I think it ties back into, is my relationship with food harming me versus helping me is usually a good gauge. But again, hard to say when we can't tell, especially because diet culture is so normalized. Constantly dieting to lose weight is so normalized. So it's checking in about some of those things of like, am I overly concerned about food? Do I spend a lot of time thinking about food? Do I engage in patterns that don't feel good or that I don't really see a lot of other people doing? Like, do I eat in secret? Do I try and eat differently in front of people than I would by myself? Am I checking how other people are eating all the time? Do I look at other people's plates versus my plate when I'm ordering? Do I not pay any attention to what I want to order, but pick the lowest calorie thing on the menu? You know, so things that disconnect us from what I want to eat and make us eat how we think we should eat. That's kind of a good gauge of if it might be disordered.
If you are listening to this and you find yourself either in the eating disorder or disordered eating category, I think sometimes there can also be some resistance to saying, am I ready to let this go? Is this something I want to address? And there's some fear behind that. There are mixed emotions behind that. I'm not even going to label it because there's a lot of mixed emotions.
So many.
What can someone do to take a first step, even if it's scary, even if they're feeling some resistance toward healing?
It is scary to let it go. In my experience, we use disordered patterns as a protective mechanism most of the time. It makes us feel more in control, or it gives us a sense of security of everything feels right. And we get an actual biological positive feedback loop when we engage in behaviors. I mean, there's all these things at play that make it feel like this is the thing. And then people want to come and take that away. And you're like, don't take my thing away.
Right.
And so I think when you're in that place of, I'm not sure I'm ready for this, I don't know what I can do or what I should do, is gather information. Even if you're not ready to do anything, talk to someone, talk to a specialist, do some reading online from legitimate like eating disorder resource places, and just gather some information. Tap into, what's my why? Like, why do I feel attached to these behaviors? What is it doing for me? And that can sometimes just open up the door a little bit of like, okay, so everything around me feels like chaos, but when I control what I eat, it's less chaos. So that can be sometimes a step, and just being curious can be a step.
That curiosity, I think, I love that you've highlighted that a couple times, because again, it's not shaming. And I think that is one of the big parts that really does stop any type of action.
Yes. Well, eating disorders are usually, or really any food behavior, I don't even have to say eating disorders, are usually built around shame. Oh, I ate this thing I shouldn't, or I'm a size I shouldn't be. So it's all built on shame. So if we then try to approach changing from a place of shame, we're so much less likely to be able to do it, and much more likely to just go back to using those behaviors to basically course correct and get back to our safe space.
Right. Yes. Because it is what you know for a while once you're sort of in that mode.
Yeah.
It's not a healthy mindset, but it does feel like a safe place to be.
It does. And when you're in it, it feels true. It feels right. And so it's so hard to think of it being any different. Just the idea of like, what do you mean I could live life and not be consumed by thoughts about food or what I can and can't eat. Like that just doesn't even feel real.
Right. It doesn't feel possible.
Yeah.
It's like maybe for someone else, but yeah.
Yes. And that's the thing I hear all the time. Oh, for other people, it will be like that, but not for me. And because that's the consensus, it feels like, well, no, I couldn't let that go, this like safe thing. And what we know of like kind of the origins of eating disorders is there's like a genetic component, there's an environmental component, and then a lot of times a triggering event. So a lot of times there's kind of this trauma response that feels corrected by engaging in our disordered eating. So to let that go feels like we're just opening up these big wounds, and oh, that's hard.
It's so hard. You know, it's not just an easy, like, I think people want to go like, well, eat something. And it's like, no, it's not that. It's not that. Do you have ways that you work with your clients to work on healing some of those places or encouraging them to find some healing in those places and or creating other safe places if this is a place that has up till this point felt like their safe space?
Yes. So it is incredibly rare that when I work with someone, they don't also have a therapist on board. So that's usually the first thing I recommend is I can do some therapeutic work, but I am by no means a therapist. I don't want to be a therapist. I almost always make sure we have a therapist on board to help with those underlying pieces. And then kind of my role comes in of how do we build a new safe space with food? And how do we challenge the false belief that what we're doing is actually the best? So you kind of dismantle some of the thoughts of like I hate to say irrational, but and those kinds of thoughts aren't built on truth. They feel true. And so we do a lot of work on, okay, so what actually is true? I do a ton of nutrition education about the role of food in our body, exactly what it does in our body, why we need to eat, how much our bodies actually need to function. So I try and override a little bit of that safeness of the eating disorder with just science and getting practice at how do I actually feel. And while it's really hard, a lot of clients can start to recognize, okay, I actually do feel better when I'm eating in a different way, when I'm eating more balanced versus under eating or binging. I actually do feel better. So we start with that. What can we start to find as true versus what we feel to be true?
You mentioned there's a genetic component potentially to eating disorders. Something I've thought about so much once I got pregnant and now having a child who eats solids is how do I not pass this on, and how do I make sure I'm not putting unknowingly or, through my own blind spots, some of my eating stuff onto the next generation?
Oh, yeah.
Do you have any thoughts on guidance or creating a healing open space for food for your children?
Yes. And oh my gosh, it's so hard. It's so hard to feed children in general.
It is.
And then you bring in, everyone comes in with their own baggage around food. And so it really is so hard. The biggest thing is to be aware of your food rules. We all have them. And to just try and bring awareness. Okay, so what are my food rules? I can't eat sugar, or I can't eat after 7, or whatever they are. Try and have a ton of awareness around them and do your best to keep them separate from our food behaviors, especially when we're eating with or in front of our kids. So it's not enough to just let them eat with freedom if you're not. So if you're restricting or binging in front of your child, that will impact them even if they have food freedom, right? So you really have to do a lot with your actions of making sure you're mirroring positive food behaviors. It's also really important how we talk about food and our bodies in front of our little ones. So doing your best not to attach any emotion or morality to food. No, oh, that's good or that's bad, or you can't eat this until you have that, which is very hard. It's very normal. I used to bribe my daughter with M&Ms to go to the bathroom. Like if we could get pee-pee on the potty, here you go. So it's not a perfect system. Do the best you can. But to really make food neutral. It's not, it's food. It's meant to be enjoyed, but it's not this overly excitable thing where, oh, this is a big treat. Oh my gosh. Which then gives kids this like, oh my gosh, why is this food so special? Or
right.
This is a bad thing, which now kids are like, but I want that, but it's bad. So am I bad? You know, so just to be food neutral. And that doesn't mean you can't set boundaries with food. I think that's the hard piece that parents struggle with of like, if I'm supposed to be food neutral, but like, I don't want them just eating all day long, what I do, it's okay to have boundaries around food, but to still not be food specific, right? So like, okay, no, we're not going to have cookies right now because the kitchen's closed right now. We're going to have dinner in 30 minutes. And you know what? I'm going to give you a cookie with your dinner, but the kitchen's closed right now. And that's not, no, you can't have a cookie because cookies are bad. It's just right now we're not eating. It's not snack time or meal time, but you know what? We'll have cookies sometime. Like we'll have that. Or that's not on the menu right now. Like, so, you know, but this is on the menu right now, and give them some other choices. So it's more about being as just neutral as you can, that it's food and all food provides something, and to let them have access to lots of different foods.
That's so helpful, because I think the boundary aspect can be really challenging to navigate and go, well, if I tell them they can't eat right now, am I not listening to their hunger cues if they're asking for food? And so how do you navigate, like, is it 3 square meals a day plus 2 snacks? Or is it, can you listen to them if they are asking for something? What is the balance to kind of strike?
Yeah. And that is hard, right? Because you have this idea of like, well, how can I raise an intuitive eater if I'm telling them,
right,
oh, well, no, you're saying you're hungry, but you're not. So some of that I say is parent instinct, which I know is not a great, you know, because Leona gets, 3 snack times and 3 meals, and she might come to me and be like, I still want another snack, but I can usually tell she just wants another snack. She's not actually hungry. We're going to be eating in 45 minutes. She'll have a chance to eat. And I can just say, no, kitchen's closed. And you want kids to eat to fullness. So a lot of times kids will graze, and that's where we see a lot of, oh, I'm just hungry all the time. And when it comes to mealtime, they're not eating very much. So it's good to have times where we don't have access to food with structure, right? So they get adequate snacks at snack time. They get adequate food at mealtime, because we want them to start to learn, okay, this is what I feel like when I'm full, and this is what I feel like when I'm hungry. And so investigating with them, like sometimes when Leona's like, oh, I'm hungry, I'm like, well, what does it feel like? Like, what's your body feeling like? How do you know you're hungry? Do you know what you're hungry for? And investigate with them, help them tune into their body a little bit.
What a great tip. I love that. And it's actually a great reminder for you too to investigate, like, oh yeah, what does hunger feel like for me? It's a nice little reminder.
Yeah.
Obviously, as you are adding foods and navigating mealtime, kids can go through different phases of pickiness, or
yes.
Sometimes you ate 2 bites. Like, is that enough? You're saying you're done. Do I honor what you're telling me? Or do I try to say, like, take 4 more bites because you're 4 years old, or whatever it is that kind of gets passed down from what was told to you?
Yeah.
How do you navigate those situations?
This is where having some structure to meals and snacks can actually be helpful, because you are completely right. Kids go through what feel like endless changes to their eating patterns, especially in those first 8 years of life. It's just nuts. I've had periods of time with Leona, especially because she's older, where she'll eat anything I put in front of her. And I've had periods of time where I will set down a plate of food and she will eat 0 of it. So part of what helps with that is having set snack times and meal times so that they're going into meal times with an appetite. That's important. And then giving them autonomy, which is very hard to do. So Ellen Satter, who's a real important person in the world of feeding kids and intuitive eating for kids, basically says to separate out your roles. So the role of the parent or the the parent figure is when and what. So you determine when food is available and what food is presented to them. And then you're done. It is then over to the child to determine how much and what on the plate they eat. And that's when all of your control issues will be activated, and you will and you will work on then self-regulating because it is so hard. Even with all of my training, I have to constantly be like, this is fine. She's allowed to. And the hard thing though is to not get caught in a loop of they finish dinner, they get up 20 minutes later, they want a snack. What do you do? And so a Leona is allowed an evening snack, regardless if she eats or doesn't eat her meal. And I just try and stick to that. So she's going to have that snack or be offered that snack no matter what. So if she's hungry 15 minutes after dinner, sometimes if it's really close to dinner, I'll say, well, would you like to sit back down and have some of your dinner? Or would you like to wait till snack? If we're getting a little bit further out from dinner, I might say, well, we don't have food right now, but in 30 minutes, it's going to be bedtime snack and you'll have a chance to eat then. So it's again, structure without punishment or anything like that, but it gives kids like routine. So if they know, that helps.
These are things that I legitimately am trying to navigate because my son is obsessed with cereal, and we get like, you know, the quote healthy cereal, which I shouldn't even be giving that caveat, but there's my own.
We all have them. You give yourself some slack.
Thank you. I appreciate that.
Yes.
But it's like he's just wants it constantly. And so it's like I've been navigating that like, okay, when do we say like, well, we're eating in 20 minutes. And when do we say like, okay, like we're going to do that. So this is so helpful.
And usually for things that kids become hyper focused on, which is again, a very normal part of food development, is to do your best to make it accessible a lot. And so it can look different ways. Like it can be, okay, sure, I'll make you a bowl of cereal as part of your breakfast or even dinner. You know, kids don't care. They'll eat it whenever. And it's going to be this amount along with the other things that we're planning to have for dinner. So more access to it can actually help to curb some of that hyperfixation that kids can get, versus if we control it too much, then they're like, okay, now I like double down on this. And this is the thing that I want. And so finding ways to, again, stay as neutral about as you can of just like, it's okay if you're like, well, cereal's not on the menu right now, bud, for dinner, but you know what? We'll have cereal tomorrow. How about that? And you can pick what bowl we're going to have in it. So giving them some sense of control, which is some of it. Okay. And then, okay, so if he's really fixated on this and he's not able to move on it, can I incorporate it into what we're doing so that it's a win-win?
That's so helpful. You talked a little bit earlier about sweets, but that's a big question that I talk to my friends about who are navigating, you know, kids eating. Something I think about a lot because you don't want to apply a morality to it, but you also don't want to say like, okay, we're going to have just like a bowl of chocolate for the taking at all times. How nervous should we be about sugar? How much should we integrate it? How can we feel more comfortable with the balance of it?
I mean, first off, let's just acknowledge sugar food tastes good. Kids enjoy things that taste good. So it can feel like this obsession when really we're just seeing that kids enjoy things that taste sweet. So if we can try and recognize where our stuff is coming up versus what's actually happening, that can be helpful. And what we know statistically is the more we control and limit sugar intake, the higher the risk that they will engage with those sugary foods in a disordered way later. So what research says, or what like intuitive eaters for kids say, is to have regular access to those things, but in a moderate way or a balanced way is better. So like we have dessert most days. It's offered with the meal. It's not contingent on the meal. And so like if it's an Oreo cookie, that's going to be on the dinner plate. It's not going to be made as a big deal. It's part of the meal. And I have seen it play out in real time. Like there's plenty of times where I'm like, is this even working? Is what I'm doing mattering at all?
Mhm.
And I have seen Leona be with friends and be offered a dessert, have a few bites of it, and get up and go back to doing whatever she was doing while the other kids are like freaking out because this is a big
Right.
treat. It's a big deal. I've seen her stop eating ice cream and be like, I'm full, and push it away, because we do our best to make it not a reward system, not contingent on other things. And some nights we don't have dessert and we just say it's not on the menu tonight.
Mm.
Or again, come at it from a factual place. Like there comes a point in the night where I'm not going to give Leona anything high sugar, not because I think sugar is bad, but because sugar gives energy. And I don't need her to get energized right before bed. And I'll tell her that. I'll say, that does sound really good, but you know what? That food provides a lot of energy, which is so great during the day, but we don't need energy right before bed. We're starting to wind down and get ready to go to sleep. So we'll have that another time. So I haven't said anything negative about it. I've just told her what it does and why we can't have it right now.
I love how validating that is. It's all these little phrases you sprinkled in, like it's not on the menu or that does sound really good, and then explaining why, I think are such helpful tools, because I think we have conceptually all these ideas about it, but then practically you go like, how do I put words to this? What am I saying? You know?
Oh yeah. And I mean, it could totally blow up in your face. I've also seen my kids like go nuts when they aren't allowed to have something, or it's like flip their lids.
Right.
But that's just them, and that's their development, and that's normal. And what I tell parents is it's not a perfect system. I have definitely used food as a bribing tool when Leona's in a store and flipping out. And I'm like, okay, you need a snack? Sure. Here you go. Because we just got to get through this grocery shopping trip.
Right.
I just tell parents, do the best you can. And that's usually good enough. It's never going to be perfect. We're all going to make mistakes. We're all going to bring in things from our own history with food. But the more we can just acknowledge it, the more we can check it, and the more we can do our best to create a good food environment as often as possible, we're doing a good job.
Oh, so well said. Thank you. If you are feeding a child, an Oreo during dinner, and they eat the Oreo and then they say, more please of the Oreo, and then don't want to touch anything else, how do you navigate that situation?
I think this is the best way to do it. Who knows? Someone may come on and say, no, don't do it that way. But it's okay to control how much is accessible at times. So I think it's good to give kids as much access as they want. Like if you're going to make cookies together, leave out the plate of cookies and let them have as much as they want, because it's a learning experience. Even if they feel sick after, it's an opportunity to say, ooh, I hear that you don't feel so good. Like, why don't you think you feel so good? Does your belly hurt? Maybe we ate too fast, or maybe, we need to eat less of them next time and then see how we feel. So all experiences can be learning experiences. And it's also okay to say, okay, so this is the amount that we have tonight, and we'll have another opportunity another night. And even if they don't touch the rest of their food, as hard as it is, we have to be okay with that.
Yep. That's that discomfort and being able to sit through and check in with your own self. I also do love that too, because saying we'll have it another night shows it's not just a once in a lifetime treat. There's no scarcity around it. It's just not a right now thing.
Yeah.
Something that I'm just returning to that you said earlier was just the importance of modeling your food behavior in front of your kids.
Yeah.
I'm so happy you mentioned that, because I was literally talking to my sister yesterday about modeling in general, modeling emotions, modeling safe behaviors. But to include food in that, I think, is so important, because it's amazing how much you gain just by watching, or the things that I inherited just by seeing my mom do it that I probably consciously had no idea about. So I wanted to underline that again, because I think that's so helpful.
I think every parent is trying to set a good example for their kids. And it's not to try and do anything, but I just don't think we realize how much our kids pick up, like you're saying, consciously or unconsciously. But this idea that we could tell them one thing, but if they see us constantly doing something different, that is what they register. And that's that kind of environmental component that we know about with the development of eating disorders. Is there's a much higher risk of a child developing an eating disorder if a parent has one, because it's just that modeling and mirroring that we see. And kids are just built to convey messages, to be personal. So if my mom or dad says that that's a bad food, but I like that food, I must be bad. You know, like kids just don't have the skills to separate those kinds of things.
Is there anything that through watching your children build relationships with food has influenced your work as a dietitian?
Oh, so much. Basically be able to let go. Is we can have all of the information in the world and there's still individual humans who will challenge everything that you do. Is that grace that you give yourself is as a dietitian, it's helpful in showing me that we are in charge of what is presented, but how the kids then use that is really their prerogative, and every kid is a different kid. And I see that having too. They're raised the same way, but are vastly different. And really just to give yourself as much grace as possible that we're doing the best we can. And parenting is really hard. And I think our current culture of parenting makes you feel like you're always falling short, and be able to separate that as much as you can. That the fact that you are trying to address and undo any harmful behaviors, the fact that you want your kids to have a good relationship with food, even if it feels uncomfortable for you, or that you're at least asking questions and being curious, these are all really good things to bring into how we're raising our kiddos.
Thank you. You mentioned something during our first interview, and I'm going to paraphrase, but it's something I've returned to a lot in my own life since our conversation. And it was something along the lines of, you don't have to feel like in the perfect state of body love, body acceptance, all of it every single day at every single moment. Sometimes it's enough that like you ate a meal today and that's okay.
Yes.
And you don't need one more thing to be, quote, failing at. And
Yes.
I loved that. Like, it gives me chills as I like talk about it, because I don't think we have enough of that. We have this like absolute, I'm going to get to this place of utter acceptance or I'm not doing it right. And so I just wanted to revisit that because I just think that's so important.
I think sometimes the like non-diet culture that I work in has swung a little too far sometimes with like, we should all love our body all the time, no matter what. And that is an impossible ask for some people. You might get there sometimes, but to expect to be there all the time is just too hard. And then it does, like you're saying, feel like just another thing I'm not doing well at. And it's again, that practice of, I might not even like my body today. I might be straight up hating my body today, but can I strive to do loving acts to my body as often as possible? Can I feed it? Can I take a shower? Can I go on a walk? I might feel a certain way, but the acts that I am doing can be loving.
Oh, that's just golden. That for me is like something I'm just going to keep taking away. Thank you so much.
Sure.
Is there anything that we haven't talked about that you want to mention before we wrap up?
Practice checking in with yourself, whether you're pregnant, trying to get pregnant, postpartum, and be able to check in with how you feel like you're relating to food. Like that's the biggest thing. Does it feel good or does it feel not good? Right. And that is usually such a good gauge for how we're doing. Like, is this food choice icky feeling, or I actually am feeling pretty good?
This has been such a delight. Where can people find you?
You can email me at gantnutrition@gmail.com. And that's Gantt with 2 T's. I am offering a discount, 20% off for anyone who is coming to me from your podcast. So please mention it if you email. Also at gantnutrition.com. I'm building that website. I'm on Instagram as at Dietitian_Katie and all of those things link to connecting you to me. So
Awesome.
Any mamas out there, anyone, even if you're not a mama, but you just feel like something's up with your relationship with food, I can help.
That's so great. And thank you so much for the work you do, because I just think it's endlessly important. It's really important to have these safe spaces and places for education and healing.
Yes, I'm so happy to be doing it. I love it so much.
Thank you so much for listening to this week's episode of Week by Week. Please subscribe, rate, and review wherever you get your podcast. Follow us on Instagram at Week by Week Podcast and visit our blog at weekbyweekpodcast.com. Check out the show notes for more information about our guests and additional resources I used and referenced during this episode. This podcast was produced during the COVID-19 pandemic and recorded remotely. Our show today was produced by me, Celeste Busa, Dave Hill, and Douglas Sarine, and produced and edited by Colleen Beasley. Week by Week is a Gumption Pictures production.